Most people think that spine fractures happen only from a fall or an accident. But in many people, especially after 50, the spine can fracture quietly without making any noise. No trauma, no fall, just weakened bone and sudden onset of pain. This is how osteoporosis presents. And one of the most effective, least invasive ways to treat that kind of fracture is a procedure called vertebroplasty. If you or someone you love is dealing with back pain after a fracture, this could change everything. Hi, I'm Dr. Arvind Kulkarni. I'm a consultant spine surgeon and a specialist in minimally invasive and endoscopic spine surgery. In this video, I'll explain what vertebroplasty actually is, when it's used, when it's not, what to expect during the procedure and after the procedure, the difference between vertebroplasty and kyphoplasty, and what kinds of results we have seen in real patients. So let's start with the basics. What is vertebroplasty? Vertebroplasty is a minimally invasive procedure that stabilizes a fractured vertebra using medical grade bone cement. It's most commonly done for osteoporotic compression fractures, especially in the thoracic and lumbar spine. When successful, it provides excellent pain relief, excellent spinal support, and a very fast return to movement without open surgery. Why do these fractures happen? With osteoporosis, bones lose their density and strength. They become fragile, especially in the spine, which bears your body weight. Even simple movements like bending, coughing, or getting out of the bed can cause a vertebra to collapse. You might feel sudden sharp pain on movement, loss of height gradually over time, stoop posture, pain that gets worse when standing, better when lying down, pain on movement. So who qualifies for vertebroplasty? We consider it for patients with a confirmed compression fracture, pain that has not improved after 2 to 3 weeks of rest, medication, bracing, MRI or bone scan showing the fracture is recent and active and with no spinal compromise. It's not recommended when the fractures are old and healed, when there is a disc-related pain, when there is spinal instability or cord compression, when there is active evidence of infection. How does vertebroplasty work? The patient lies face down under local anesthesia with sedation. A needle is injected using a fluoroscopy as guidance into the fractured vertebra. Then we inject bone cement into the fracture line. The cement hardens in minutes, stabilizing the bone. The patient rests briefly and is up and walking the same day. There's no stitches, no general anesthesia, and often no hospital stay is required. Let's talk about vertebroplasty versus kyphoplasty, because this is where a lot of confusion comes in. You'll often hear that kyphoplasty is an upgraded version of vertebroplasty that uses a balloon to lift the collapsed vertebra before injecting cement, and that it restores height. Sound fancy, right? But here's the truth. All the real goals of fracture stabilization in terms of pain relief, preventing further collapse, improving mobility can be achieved with vertebroplasty alone. Kyphoplasty adds more steps, more surgical time, more cost. Studies have shown that it may have a slightly higher rate of complications as well. In my opinion, kyphoplasty often ends up being more of a marketing gimmick than medicine. There's hardly any indication for kyphoplasty in our current understanding of spinal osteoporotic fractures. Does vertebroplasty really work? Yes, in the right patient, it can be life-changing. The pain relief is immediate, the mobility is immediate and improved. There's reduced need for painkillers. There's increased independence and freedom in the affected individuals. But remember, it treats the fracture and not the bone loss. That's why follow-up treatment for osteoporosis in the background is very critical. When vertebroplasty alone isn't enough. Now, in most cases, vertebroplasty gives excellent pain relief, especially when the fracture is recent and the spine is otherwise stable. But like any other medical treatment, there are exceptions. A small percentage of patients, for reasons we don't always fully understand, don't experience the expected level of pain relief after vertebroplasty. When that happens, we reassess the patient. Sometimes the vertebra may still not be stable. There may be micro movement around the cement area that's keeping the pain alive. In such cases, we may recommend an additional procedure called percutaneous pedicle screw rod fixation. This is a minimally invasive technique where screws are passed through small incisions to stabilize the fractured segment without needing a large open surgery. It's rarely required though, but when needed, it can offer the stability and relief that vertebroplasty alone cannot provide. As always, the goal is to preserve mobility, reduce pain, and avoid over-treatment. Vertebroplasty isn't a miracle, but for the right person, it can mean walking without pain, Sleeping better, avoiding unnecessary surgery. If you or someone you know has sudden onset back pain, especially after the age of 50, don't ignore it. It could be more than just a sprain. It could be a fractured spine. Like this video if it helped you understand your options. Share it with someone living with osteoporosis or recovering from back pain. And subscribe for real, honest spine education. No hype, just help. I am Dr. Arvind Kulkarni. I'll see you in the next one.